Welcome to Diabetic Retinopathy, Preserving Your Eyesight at Diabetes Eye Health. My name is Dr. Richard Beezer, and I'm a senior physician and chair of the Continuing Medical Education Committee at Joslin Diabetes Center in Boston, Massachusetts. I'm pleased to serve as moderator for this program. I'd like to introduce Peg Abernathy and Evelyn Smith DeMille, our patient presenters, as well as Dr. Deborah Schlossman, an ophthalmologist at the Joslin Diabetes Center. Peg, you've alluded to some of these already. Perhaps you can tell us a little bit more of what you've been through.
Well, the actual exam itself is, like Evelyn said earlier, they do the dilated eye exam. That's what I had, and then I was sent to a retinal specialist who did that again and who also did scans of my eye. And let me just say that I was so in denial, about this whole thing because I have 20/20 vision, at no symptoms at all. I think that's a key takeaway to this educational program. Just because you don't have a symptom doesn't mean anything, right? Because I had nothing, 20/20 vision. Anyway, got diagnosed, and so they did the scans and then went through the laser treatment where I sat in front of a machine and he did the laser treatment on me, and I had 2 rounds of those in each eye, and then went back and had the anti-VEGF injections, 2 rounds of those as well. And then after that treatment, he said, "You're doing great," and that's what held me because I caught it early enough. I'm telling you, if I wouldn't have been going to the doctor on a regular basis, I would most likely be blind right now.
Now, you say the doctor. What kind of doctor did you seek out when you decided to take good care of your eyes?
The ophthalmologist is the doctor that I used to see on a regular basis. It was a yearly basis, annual visit. And then once it got to the point where it is now, he referred me over to a retinal specialist who is the doctor who treats me now. So this doctor works on the retina and all that, so yeah.
And what about people that live a distance from medical centers, that may live out in the country? Perhaps, Deb, you can comment. What advice should you give them where this sort of care is a bit distant from them?
As Dr. Murtha Tim said, I think it's worth it, to travel. I think if an ophthalmologist or optometrist finds that there is significant retinopathy, I think you really need to be seen.
Absolutely. And, I live in LA, and I'm only 22 miles from my doctor, but it takes me 2 hours one way.
Well, that's LA
it.
traffic.
Yes.
We won't get into
That's
that.
right.
We do have quite a few people at the Joslin who come from New York and various places every 4 months, even though there are great people in New York, but they, people who do travel a bit.
Yeah.
It's worth it once you find someone that you trust.
Right,
I think trust is important. Yeah, and someone, when being in denial like I was, I did look at the retinal specialist, and after he was yelling at me, "You're going blind," because I was sitting there looking at him like, "Are you sure?" Anyway, he slapped me down. I said, "Okay, I have to trust someone, so I'm going to trust you." And that's the way, from there on out, that's what I have to do. So I think it's important to have a good relationship and a doctor that will talk to you, and work with you and help you along the way. I'm very excited. There's so much hope out there, and what a terrible thing to have to lose your vision when potential treatments like these are so helpful in so many ways.
So again, taking charge of your eye health. Peg, perhaps you can talk to some of these points.
Yeah, I've always had decent blood control. I'm type 1, and I do go up and down. Personally, I have a lot of issues with up and down a lot, but wearing an insulin pump has helped me. But again, I think the key for me was getting CGM, so I was able to more safely get my
continuous glucose monitoring.
Yes, thank you. That helped me a lot. And then also the understanding blood pressure. Because again, I know I've alluded to that a few times, but to me, I really didn't know that, and you'd think I would, but no, I didn't know that, and now I'm really tight with the blood pressure as well, so I think they go hand in hand for me, so I do that as well, and multiple checks, check my blood sugar a lot.
Okay, I'm going to throw this out to both Evelyn and Peg. What advice would you give our listeners as to the questions they need to ask of their ophthalmologist or optometrist as they see them? What are the key things that you should tell them to make sure they cover in their conversation?
Well, actually, the first off with me, I went in right off the bat very early on, and I wanted to get a baseline. look at a baseline scan, or not scan, but a baseline exam. And I went to the same doctor who watched me every year. So for me, that was important, that they could watch any changes that might come up. And every time, is it okay? Do I have glaucoma? Do I have this? Do I have that? And just know what you're talking about. Do some research on it. And so you can go in and ask the smart questions. So,
Evelyn?
I think from my perspective, I learned actually from the very first physician I saw at Joslin back in 1969, and he told me that I was part of my medical care team, and I needed to act like that. I needed to question my doctors. I needed to ask them to communicate clearly and at my level, and I've been doing that ever since. And I think the issue of trust is just so important, which again, I have to say I feel very privileged to have with my eye care specialists, both my optometrist and my ophthalmologist. I could not consider anybody else. I hope I never have to consider anybody else for my eye specialists. And I am, again, very grateful for the care and the team that I have. Also, my diabetologist is part of that team because she communicates with my eye care team. And again, they need to have good communication back and forth.
and you know, if I may say, people like you, Evelyn, are my heroes. I mean, you've lived with this condition long before we had the tools we have today, right? You know, I can imagine the things you've seen in your life in diabetes care. So my hat is off to you. That's a long time to deal with this condition. So she's a hero of mine. I love that. And so congratulations.
Well, thank you. Thank you.
And I hope that when I get to be at that many
46 years.
46. Well, I'm behind you. I'm 27. So, but still, it's hard, isn't it? It's not easy.
It is not easy. It can be very frustrating, but we really don't have a choice if we want to keep going with the best health we have.
And also, what I tell people is just do the best you can every day, and recognize that your best is going to change from day to day. There's some days, I don't know about you, that I'm all over my diabetes. I've got it down, and then I'll wake up and it's like, really, again? And
what did I do?
Right. And you wake up in a weird blood sugar, or you'll do something, everything the same, and it'll end up with a completely different result. And that's the hard part, is that it's so random.
Peg, you bring out a very important point, because as a diabetologist, I often say to people, you need to differentiate between your goals and your realistic expectations. Yes. The goals are normal blood sugars, normal A1Cs. Well, that isn't a realistic expectation for a lot of people. But if you set the goal being normalcy, then if you fall short, which is expected, then you're still aiming for a good level. And I think people shouldn't feel that as every blood sugar may not be exactly where they'd like it to be, they're not killing 3 eye cells, 2 brain cells, and a kidney cell. They do the best they can, and ultimately that will serve them well.
I think that's a really good point, and you just have to give yourself a break and take the judgment out of it. I look at my blood sugar number as a number. I don't say, oh, that's a bad number or that's a good number. I say, well, this is the number. It is what it is. Now, what do I need to do to move on with the day? So,
Deb, perhaps I can ask you from the perspective of an ophthalmologist, what questions would you encourage our listeners to ask you when they come to see you about their eyes?
Well, I think it's nice if they understand really, as I was talking about in the earlier section, just really what retinopathy is and just be able to visualize it. One thing also, as an aside, I've found is that patients sometimes come in and they're almost afraid to come in, and I think they put off the exam because they're afraid of what we might find. They'll say, oh, my blood sugars have been terrible for the past year, so I just don't even want to know what my eyes look like. But as you said, Rich, it really is a long-term thing, and you try to do the best you can. Sometimes things come up, sometimes there are illnesses, and sugars may not be good for a few months, but the retinopathy really reflects sugar over a long period of time. So having a few bad sugars over a few months is probably, in the short term, not going to make a huge difference. And you're always better off knowing how much retinopathy you have, because again, it's so treatable. So there's really nothing to be afraid of, because chances are and again, in most cases, we don't see too much retinopathy, but if we do see retinopathy, we have so many effective treatments, and it's just not something I would put off. I think it's just something you're much better off being educated.
And I think that that's a really good point, is fear, because Evelyn and I were talking about this before, and don't let fear of the unknown keep you from taking care of yourself. And some days, and I'm not going to lie, I get so scared when I go to the doctor, because I think, oh my gosh, what are they going to find? Is it going to be worse? But and the days that I just find that I can't do it for myself, then I think about my husband. Well, I'll do it for him, because as devastating as blindness would be to us, think of the impact on your loved one or your spouse or your family. You want to be able to see your kid walk down the aisle. You want to go to the soccer games or watch your grandbaby be born. All these things, and don't let fear keep you from doing, getting out in front of it.
So that's how you handle your anxiety.
It's scary. I mean, I'm not going to lie. I've been dealing with this now for years, and a week before I go in, I get the stomach and but I just go because I have to do this. I owe it to myself.
Evelyn, how do you deal with anxiety?
Again, the anxiety before an eye clinic appointment, I have always said, you can cut the tension in the waiting room at the eye clinic.
Yes.
But again, I really believe in the prevention, and I really believe that you're better off knowing where your enemy is, and you can't know where your enemy is in terms of retinopathy unless you have a good, clear picture of what's going on in your eye.
Absolutely, and there's hope now. It's not, we've got these fantastic anti-VEGF treatments for retinopathy, so there's actual hope. So it's not all doom and gloom, fingers crossed, you never know. Everybody has a different outcome. But for me, it's been a miracle, nothing less. I say that all the time.
And when you leave your visit, you really should have a sense of your level of retinopathy. I usually go over the photos with my patients. I think if you take pictures, that we have them on the computer screen now, and I explain what's going on, the areas we may be watching, concerned about, and why we want to see them back maybe in 4 months, and just again what symptoms to look for. If they notice any, specifically new floaters or other changes, to call us sooner.
That's important. I think communication is key. Often when I see patients in my practice that have come back from seeing the ophthalmologist, I often ask them, what were you told? What was your impression? Because I want to know if they got a good sense and can reiterate it to me as to whether they're understanding what's going on. I think that communication is really very important. All right, let's handle a couple of questions that are coming in from our audience. There was a question earlier about insulin with adverse effects on the eyes, and I think I want to hone in on one other key point. I was an investigator with a study years ago called the Diabetes Control and Complications Trial, and one of the things that we found is that when people were in poor control and rapidly improved their control with insulin, this was with type 1 diabetes, they had a worsening of retinopathy. Is that a fear today, and how do we handle that, Deb?
No, that was widely publicized, but what the study really showed was that there was a transient increase in what we call cotton wool spots, which are just little white deposits that are seen in retinopathy. But in the long run, people with better control, even with this transient worsening, did much better. So it's really not something to be concerned about. I do think close follow-up is important, and if you're instituting sudden tight control, it's a good idea to be seen by your ophthalmologist a little bit more often. But we definitely recommend tight control, especially early on in the disease. We know that the sooner after diagnosis you initiate tight control, the longer the benefits, and the greater the benefits on development of retinopathy.
Thank you to Genentech for their support of this educational program. I would like to remind you that additional videos are available at diabetesEyehealth.com. Thank you for joining us.